and this is our podcast, Diabetically Speaking with SmartMove360. We are meeting every Thursday at 4 p.m. Eastern here to talk about everything related to diabetes. We invited different guests, and today we have a very special guest with us. Let's go. Hello again. This is Irina Strunina with the Diabetically Speaking with SmartMove360 podcast. And today our guest is Tina Baxter. She is registered nurse. She is one of our guest nurses in our Facebook group, Diabetes 101 for Beginners. And this month, I'm trying to bring more nurses to our podcast. So, Tina, tell us a little bit about yourself.
Okay, great. Yes, I'm Tina Baxter. I live in Anderson, Indiana, and I have been in healthcare for 25 plus years. I actually started out as a certified nursing assistant and worked in the lab as a lab tech in high school and went to school to become a registered nurse. And my background happens to be in geriatrics and in psychiatry. And I went on and became an advanced practice nurse and got my master's in nursing education and a postmaster's as a nurse practitioner.
Wow. What a resume. Thank you for joining us today. And just to let everybody know that Tina also a member of this group. Uh, how do we call this group? The Empower People That Care. They are working with our Facebook group Diabetes 101 for Beginners, helping us and people, nurses who are associated with this group actually are leading our Tuesday events called Telenurse Tuesdays, answering your questions. So if you happen to be on Facebook on Tuesday, you will see that post where you could actually post your questions for our nurses and they could answer them. This way you don't need to drive whole way to your doctor's office. You could speak with your nurse, our nurse, uh, in Facebook, or even you can connect with them and have a chat in a private matter. That is our introduction period, and I would like to have a conversation about nurses. Tina, you have 25 years of experience in medical field. You've been looking at it from different perspectives. So what, in your opinion, is the reason why nurse is such an important component for people when they are taking care of their diabetes?
Well, one of the things that nurses can bring to the table is an understanding of what's happening in the body and helping to the individual to interpret that. So a lot of times patients will go see their provider and they'll hand them some paperwork and explain things, but they may have questions, but may feel a little bit hesitant to ask the doctor. I don't want to take up too much of his or her time. Uh, so they have questions, but they may be afraid to ask them, or maybe they think it's a stupid question that they don't want to ask and be embarrassed. And so,
Mm-hmm.
what's nice about the nurses is that they can come in and provide that education, and that's what nurses are uniquely trained to do, is to provide that patient education and to help guide them into making decisions. And so, if you've been in the Facebook group during a Tuesday, you'll often see questions that people ask about specific medications. And although we can't give medical advice, we can give you medical education about that medication or about the treatment that you're giving, and giving you tips and pointers to go back to your provider to ask the appropriate questions.
Yes, thank you. And you totally, the story of my family is that nurses were actually the people who educated myself and my late husband about the diabetes, what we need to know, what we need to pay attention to. Because, yes, you're right. We go to doctor's office. I know men specifically, especially, you probably have seen that they don't like to complain. They don't like to say that they don't know something. So they would say that everything is okay, or they will discuss some one matter that maybe not doesn't matter that much, and they would not ask those questions. So nurses, having good relationships with nurses, I did find it very, very helpful for us as well, just for supporting people, right?
Well, yes, and nurses again have been voted by Gallup for the, I don't know how many years now, but several years in a row as the one of the most, as the most trusted profession. So
Mm-hmm.
we instill a lot of trust, and we really work on that relationship that we have with our patients. And so we're very careful about what we do. And again, we don't provide you with medical treatment outside of the parameters of our job, but we can give you that education, and that's all part of the purview of being a nurse, is giving you that good education.
Yes, yes, definitely. Having good relationships with the nurse in your doctor's offices is so helpful, and it's very important. Okay, so you already started on it. So what kind of help nurse can provide to the patients?
Sometimes it's going through the complex regimen. And like, for example, if I have someone who's newly diabetic, I want to explain to them why they need to take their insulin and why they need the insulin at a certain time of day, why they
Mhm.
need to check their blood sugar as many times as they do. Because when you're initiating treatment, you want to see if they've got good glycemic control, but you also don't want to get over treated where they have the critical lows. And I
Yes.
explained to them, I said, having the lower blood sugars is a lot harder to treat than treating the higher blood sugars. And
Uh-huh.
so when you explain it to them, so that they're not so caught up in the numbers, and that's one of the things I noticed in the Facebook group. They're so concerned about the numbers, right?
Yes.
And it's not necessarily just about that individual blood sugar at that time. It may, if it's really high, indicate something, or really low, there's an issue. But oftentimes it's that kind of high, middle of the range. It kind of gives you a snapshot of that particular time, but 30 minutes later, it may be a little bit different. And so when I teach them, I tell them, hey, your hemoglobin A1C, that's what your doctor is going to be looking at. That's what that nurse practitioner is going to be looking at, because we want to see how your blood sugar is generally doing over time, and sometimes not that specific one time it was high, one time that type of thing. We're looking for patterns, and when I explain that to them, that's a little bit more helpful, and it kind of alleviates some of that anxiety when you get a new diagnosis of diabetes, and what could I have done, and could I have prevented it, and all the things that go in your head. Is it because of my genetics? Is it because of what I'm eating? Can I blame it on my mom? All those
Yes.
different things. Or as my dad did, he blamed it on my mom, and blamed it on his wife, and saying that she gave him diabetes.
Yes. Yes. Well, okay. So you can explain the way how this is something that we all need. This is, I think, the reason why so many people have this diagnosis, because we don't know enough about diabetes, and of course, the best way is to prevent this diagnosis. But once we already got it, it's better to know what we're dealing with. And doctors, in their 15 minutes of being with you, maybe 10, they don't even have time to talk about those details, right?
That's right. And so your primary care appointment, or even your appointment with your specialist, with the nurse practitioner or the physician, maybe 15 to 20 minutes if they're generous. And so having that opportunity for diabetic education, working with your dietitians, all those things, it should be an interdisciplinary approach to care. And
Hmm.
that will help the best outcomes for the individual, is everybody's working together collaboratively. It does me no good to tell you, okay, you need to reduce your sugar, and then I don't explain to you that fruit has sugar, right? So people think, oh, I have to stop eating chocolate cake. Well, no, you can have chocolate cake. You just might have to eat half a piece, not as often.
Yes.
You might have to cut out the roll if you're going to have the chocolate cake. We want you to be able to live and enjoy your life. And this is where the nurses can teach you about how to make your diabetes not your whole life, but just one component of your life that looks at things overall and being realistic. If you were to tell somebody they could never have chocolate cake ever again in their life, how successful do you think they would be?
And well, I would not very strong in my opinion about it. I think there are very few individuals who can handle themselves, but majority of people, when they have strict parameters, they are pretty much set up for failure.
Right. And let's think about you have to look in the fact that there's a lot of cultural implications as well. I
Yeah.
mean, we just ended Thanksgiving and Christmas, and now we're coming up to Valentine's Day.
Oh
And
my
I don't
God.
know about you, but I was like, wait a minute, Valentine's Day is falling on Ash Wednesday. That's horrible because a lot of people, Catholic or not, will give up something for Lent, and that's the beginning of Lent. And I'm thinking, okay, so if you gave up sweets, Valentine's Day chocolate for you. So we celebrate a lot of things in our culture with food. We have traditions, and so you need to be able to honor those traditions as well as integrate that into the family. So one of the things I did for heart health, because February is also Heart Health Month,
Mm-hmm.
and one of the things that I did one year is talk to people how to take traditional soul food and make it in a more heart healthier way. Like,
Yeah.
for example, substituting the fat back and the pork products and maybe use smoked turkey or other lean meats to season your greens. I mean, things that we can do by honoring those traditions, but then not taking away everything from them. And so that's the important part.
Absolutely. And yeah, and I am just wanted to bring up again this point that when we visit doctor's office, we got to have our own advocate there, somebody to talk to, and nurses, I think, in my opinion and my experience, are the best people to talk with, because yes, doctors' assistants, the ones who are just greeting you in the office, they could give you a little bit of information, but because of the way level of education and also how much they allowed to give, they will give you just that much. But nurses have this huge uh, section of knowledge that they can share and willing to share if you're willing to listen. This is
Yes, and nurses are very good at research too. So if they don't know the answer, we can
Mhm.
usually find it,
Yes.
right? And so we're very good at problem solving. That's one of the things that we talk about with nurses with entrepreneurship, is how good we are at problem solving and taking those skills and put it in the entrepreneurial realm. And so I see that when patients or clients come and ask me, I get people stopping me sometimes in the grocery store and asking me questions about this, or family members that will send me text messages with pictures of wounds and sores and whatever else, and say, what do you think about this and what should I do? And so nurses are usually very giving and open, and then we're good at saying, hey, this is outside of our scope of practice, but I would say you need to take this to your family doctor. You need to go to the hospital. You need to go to the ER. And so sometimes just having that second person
Yes.
validate what you are experiencing really helps the client. And so nurses walk that fine line between the medical and the personal, because the nurses are the ones that see you at your barest, right?
Mhm.
We help you take your clothes off, we give you your bath, we give you your injections. We've seen it all, and so we enter into that intimate space that maybe other clinicians do not. And so I think that's the unique benefit of using nurses.
Yes, absolutely. And I just, I'm back to my personal experience. I do remember that when my husband got diagnosed with diabetes, for years he was going to doctor's office, as I said, never will bring back to me information that he got in the office. Primarily, my blood sugar got better, and or I got new medication to take. This is about it. What else did you learn? I didn't learn anything except for my blood sugar results. That's it. How much he was interested to learn. and how much time doctors had to spend with him to educate him. Practically nothing. It's later when he got actually complications from diabetes and I started going to doctor's office. This is when nurses finally I had chance to ask those questions, and they told me that there are some diabetes education classes out there. They gave me phone numbers and doctors names and offices names where those classes are happening. They even kind of gave me their personal preference. You could call this many offices, but I personally prefer that one. This gave me much better information and grounds to how I could be more helpful to my husband, when because he was not sharing with me any of this information.
A lot of times, men,
Yes,
let's
that's
be
what I would
real,
say.
they're brought in by their wives because of a problem.
Hmm.
And I can say this from personal experience that I noticed that when I started taking over more of my husband's healthcare, his healthcare was better on track because I would ask him, "Hey, what did the doctor say?" "Oh, everything's fine. It's good."
That's it.
Knowing that creatinine level was going up, not knowing that potassium level was off the charts, not knowing that his blood sugar was still too high, everything was good because that's all they hear. And
Mhm.
again, not man bashing, nor am I putting everybody or overgeneralizing, but a lot of times it's the wives that will bring the husband in and say, "There's a problem. I don't know how much he's told you about it, but this is what's happening." I also see the opposite happen, where I've had an older couple come in and the husband says, "Oh no, she's not telling you the truth. She's not sleeping. She's
Mhm.
snoring really loud. She's hitting me in the middle of the night because she's having nightmares." I said, "Oh." And she sheepishly looks at me. And so so it helps if you can bring a family member to your appointment that maybe they can hear things and remind you of things that were said. Take a notebook with you and write down what they tell you. And then later, if you have questions after you go over what's in your notes, call them back. Set up another appointment. Talk to the nurse and say, "Hey, I just saw the doctor today. He said this. I'm not sure I understand what that means. Can you go over that with me?" The nurses there are more than likely ready to help you. And what's great is that there's programs out there like Empower, that
People.
will help yeah, that will help you do those very things and have those nurse contacts so they can be with you and answer some of those questions and then give you the appropriate questions to ask. That's one of the things that I teach in the chronic disease management program. It is what to ask of your provider when you go in to see them. What are my numbers and what does that mean? And then what should I do?
Yes, yes. Well, Tina, you already started answering my third and last question: how to use this resource to having the nurse in doctor's office so it will be most helpful, most effective for you as a patient. So bring your relative, write a list.
Take notes. And then can I just say, ask the question. I
Yes.
cannot tell you how many times I've sat in front of a client who said, "Well, I meant to ask you like two or three times ago, but I felt nervous or scared to ask you about whatever else." Right.
Mhm.
And I have a sign in my office that says, "Please ask the question because mind reading costs extra."
Yes.
Right? The clinician oftentimes has no clue that you're confused about something or you have a question, or maybe you heard something from a family friend or you saw something in the Facebook group that you thought, "Hey, this might work for me." Ask the question and just preface it as, "Hey, I was in this Facebook group. Someone happened to mention this medication. I was curious if it could help me get my numbers in the better range. Do you think that's something that might work for me?"
Hmm.
So you're not, you want to be a collaborator with your provider.
Yes.
Don't sit out. And this is what I see a lot of people do. They're kind of like, "Well, I don't know. The doctor just said take this, so I just take it. I don't know what it's for. I don't know what it does." No, you have to be the driver of your own healthcare, and you have
Yeah.
to be an advocate for yourself. And part of that is to make sure that you get the education. And if there's a problem, like you have a loved one that has a cognitive problem, maybe some forgetfulness or dementia, you as a caregiver will then have to be that advocate for them and to ask those questions. And again, don't be afraid to ask. And ask respectfully. And most clinicians, if they're a good, honest clinician, will take the time to educate you or explain to you why that particular medication might not be the best for you. If
Mhm.
you already have kidney problems, certain medications you can't take.
Yeah.
But you just see the commercial on TV, you think, hey, these people seem happy. They're dancing around and singing. I want that feeling. But
Yeah.
then your clinician can explain to you that medicine works for these people in this category, but may
Mhm.
not be appropriate for you. But maybe it brings something to their mind, but maybe something else in a different category might be more appropriate. And I have those conversations with my clients all the time about why I'm choosing the medication and what we're trying to treat with the medication. So if you don't know, ask.
Absolutely. Tina, this is very educational already. Thank you very much for bringing it up and explaining it again, because sometimes this is the we hear it here and there, but to hear it one more time may help us to actually start using the suggestions, the ideas, the w- what tips you can give, because we all learning from each other anyways. Now, we have a little bit time left, and I wanted to ask you just one quick question. We already mentioned with you empower people that care a couple of times. I said it, you said it. What is it? What is that organization? What we are talking about?
Yes. So, Empower People Care, we provide nurse advocates for you. So, these are patient advocates that can help you answer questions, perhaps in your area, in your state, maybe attend appointments with you, either in person or virtually. So, it gives you a chance to connect with a nurse that could be kind of like your personal concierge nurse to ask questions of. And what's great about the platform is that you can go right on the app and select a nurse that you want to talk to. And if that relationship is successful, you can book with that nurse again. If you want to choose someone else, there's a bevy of nurses that you can choose from with different specialties and backgrounds. So that's what's great about it.
Absolutely. And I just wanted to say I was so happy when I met people who, well, the owner of this group, who organizer, creator of this group, that this is something that I wanted to give to our Facebook group, Diabetes 101 for Beginners, from the very beginning, because not everyone has the medical insurance. Not everyone has the ability to visit nurse at any time. Maybe they cannot drive. Maybe this is so far away. Maybe some other reasons why they don't have a car. Uh, or maybe they just don't know, and they want to hear a second opinion. And to have this resource available, I believe, is very helpful. And I appreciate, Tina, you and Pam, that you both are coming into the group, helping our people, answering questions. And now, look, you are. Last week, Pam was my guest on the podcast. Today, you are my guest on the podcast. Hopefully, we will see you on my diabetic healthcare event. Maybe we will talk about it.
Okay.
And this is great help that we have from nurses and from empower people that care in general. With that, I wanted to just give our listeners a little overview of what's going on before we wrap up our podcast. So, I wanted to remind everyone that every Thursday at 4 p.m. Eastern Time, we go live in our Facebook group, Diabetes 101 for Beginners. Plus, I have it on several of my personal pages, and we will recordings will be available, and they are already available for previous podcasts on many podcast platforms that you know of. All right. Now, on Mondays, we have Monica Henderson, our agent of change, going live into our Facebook group and give giving you some inspiration for the week that is coming up. On Tuesdays, we have Telenurse Tuesday. We already mentioned today this event, and our nurses, Tina and Pam, going to group and answering your questions. On Wednesdays, not every Wednesday, but every other Wednesday, we have support group meetings where we meet our admins, some experts showing up in the group uh, at this group meeting and meet with our members and answering some questions. And sometimes people come over there because they don't have support people around them and they get support from us. Sometimes people have achieved something and they come to say, look, I've got such and such results, and we congratulate them and celebrate them. Sometimes people have questions, problems, and they are looking for answers and they want to receive them directly from our face to face instead of post it in a group and wait for somebody to answer. On Thursday, as I mentioned, we have our podcast, and on Fridays, our personal trainer, Trevor Brown, he hosts those Fitness Fridays events. In the morning, he goes live and he talks about uh, exercises, different things, different physical activities that you can do to help yourself to improve your health. And he is also mentioning and how the nutrition can help you. What can you use to eat? How, when you build your menu, what can help you to feel stronger? What else do I need to say? I wanted to say that our events are all sponsored by Mink Life Motivation, On Balance Entertainment, Life Based Solution. It's Trevor, and Empower People That Care. It's Tina and Pam and some other people. And I wanted to let you know that tonight, it's Thursday, the February the 8th, we will have masterclass, carbohydrate masterclass, where Trevor will be talking about how to control your blood sugars, increase your energy, and reduce body fat while eating carbohydrates. It will be live in our Facebook group at 7 p.m. Eastern Time. We also will have some recordings available after it. And the last piece of information I wanted to bring up, and this is our event, Diabetic Healthcare Expo. This is our event that we host already the 12th time. We do it every other month. So we have people, healthcare providers, we have people who support those who have diabetes. They sometimes it's social workers, sometimes it's insurance brokers, of course nutritionists, of course doctors, nurses, PAs. They are all coming together, and we have this kind of like diabetic 101 crash course, especially helpful for newly diagnosed to uh, wrap your brain around this diagnosis and to learn what you need to be aware of, what you uh, are in charge of, and how and where to look for help. These are my announcements for today. With that, let me click that, bring us back with Tina, and say, Tina, thank you very much for sharing today with us your information. I wanted to let everybody know that if you would like to connect with Tina, here's her direct link so you could schedule a call with her and she could talk with you about your particular case and what can be helpful to you, where to look for help, what doctors are helpful. And sounds to me that Tina has not only diabetic experience, but also in some other areas as well. So if you feel that, okay, I got my diabetes under control, but this problem is still my question, you can schedule a call with Tina as well. That's it. We are done for today. Thank you very much, Tina.
Oh, you're more than welcome.
And we will see everyone next week uh, for the diabetically speaking with SmartMove360 next episode. Have a great rest of your week.